All right, so right here is more of like we're trying to define some terminologies, right, as regards to an abnormal pregnancy that could actually take place in the fallopian tube. All right, so we'll talk about what is known as a tubal mole. We'll talk about what is known as a tubal rupture. So of course there is a tubal pregnancy, then the embryo was getting big till they actually outgrew the fallopian tube and it ruptured. All right, then tubal as abortion just simply means it could be that the pregnancy was there so you lost it. So let's define it. So first of all, this is what is known as a molar pregnancy. Okay, so most of the times it occurs in the uterus, but sometimes it can occur in the fallopian tube. That's why you say it is tubal mole. Okay, so tubal mole refers to what? A rare form of ectopic pregnancy where the implanted embryo in the fallopian tube develops into molar pregnancy like this. Okay, it's rare that I couldn't even get a picture for it. So typically it develops into a partial hydatidiform mole. So it's characterized by what? Abdominal trophoblastic proliferation and swollen chorionic villi. So it resembles a molar pregnancy that could occur in the uterus. So clinical presentation is there's vaginal bleeding, there's elevated human chorionic gonadotropin levels, may actually mimic a standard ectopic pregnancy. So you can usually confirm it via histopathological examination after surgical removal. Okay, so tubal rupture, this one just have to do with there was ectopic pregnancy, so the fallopian tube kind of like busted off, okay, leading to internal bleeding, of course. So symptoms you have there is sudden severe pain, signs of shock, vaginal bleeding. So complications, you can have blood in the abdomen. It's a life-threatening emergency requiring immediate surgery. Risk factors is that's what is making it possible for you to have a rupture of that ectopic pregnancy in the fallopian tube is if the dictation of the pregnancy was late, okay, and if you previously had issues of ectopic pregnancy. All right, so tubal abortion now is a spontaneous expulsion of an ectopic pregnancy from the fallopian tube into the peritoneal cavity to the fimbriated end. So pathophysiology, the pregnancy detaches and exits the tube without rupture, may result in bleeding into the peritoneal cavity. Issues you have is vaginal bleeding, abdominal pain, may be less dramatic than the rupture. Do you understand? So this one, you just lost the pregnancy in peace, while the other one, you lost it via a rupture. Okay, so management depends on how stable the patient is.